to me, I mean, as a researcher and medical doctor, and it's very important to have transparency in science and to communicate all the results that we have validated scientifically. That's very important. And currently with the pandemic, it's another, it's more and more important because we need to be fast and to have more information and to transmit this information just on time. And that's important to have the transmission of this information to all the medical community, but also to the overall population. I have no doubt on that, and I am pro the open access science, since I am also the editor-in-chief of JHEP Reports, that is the first full open access journal of EASL. So I believe in open access science. But the thing is that it's not because we need to be very fast that we have to publish or to deliver some informations that are not validated. And what we need also to do and constantly, and we need to transmit some information that are validated and that are true information, and not just sensitive information or journalism that are not our job in terms of medical doctor, professor, academic, and faculties. And so we need to control what we have to deliver. We have to privilege the journals that are publishing very good science. What is most important is to have good papers, innovation, I mean, validated studies, studies that can really change the care of the patients. All these questions need to be answered before writing and publishing a paper. And what I am believing in is really good journals that are with a good track of selection of these papers, where we can really publish what is important for the future to improve the care of the patients, but also to be very careful in the not publishing results that are not very well validated or not really contributive in terms of knowledge and increasing our knowledge in the field. Thank you for the question, because it's very interesting to analyze what is happening now currently in the field of publication of papers and articles. We have this pandemic. We have a lot of things that we don't know that are really very important to better understand. What is this virus? What is the evolution? What is the description of the disease? We are starting really from scratch. We know nothing about this new disease that is devastating all the world, and very fastly also. So there is an emergency to increase really and to our knowledge and to describe and to better understand then the mechanism of the disease, and then for sure to how to interfere and to treat this disease and to prevent the occurrence of the disease, and to better understand which patients is going to develop very severe complications or not. So this is major questions we need to answer quite fastly because of the number of deaths and the evolution that is so fast and without knowledge. But so in this situation, we have to face with an increased number of papers that are published. I think that there is more than 3,000 papers that has been published in the last month for a disease that was not known before. That's incredible. And we can see this publication in various types of journals, some that are very prestigious, others that are not prestigious. It seems that the most important is to deliver the information. So with that, again, we need to be careful and to pause and to respect the process of publication in terms of science, we need to review carefully the papers. We need to avoid to have a conflict of interest. This conflict of interest need to be delivered and mentioned in the papers. That's very important. We need to keep the ethical rules very carefully once again, and to follow that during the process of publication, whatever the type of journal. So for sure, we need to accelerate, because the problem is now, right now, we need to better understand for all the community, so to give the information, but it's not journalism, it's scientific publication. And so we need to be really careful on the impact of what we are publishing, and to respect really science, to have some hypotheses, to demonstrate this hypothesis, and to validate this hypothesis, even if sometimes it's a little bit premature, but then we need to modulate our message and to mention that it should be further validated and etc. But we don't have to overstate our conclusion in this moment, because it is so hot, and it is a concern that is so important for the overall population worldwide, that we have to be very careful in the consequences of too fast publications that are not validated, and that could be devastating really some process in our society. And I have to say that we have to face with that in France, for example, where we have some contradictory publication of some scientists that are really delivering some contrasting and messages through social networks, or also through publications, probably too fastly. A lot of debates are good, but when it's very well constructed debates, and when we can also exchange the idea and validate also what we are saying. But the political debates that are only for the communication, and too much for the it's too much, and we need to really be careful. We can reinforce some extreme ideas among our population, and that's really not good, because our population are waiting for answer from the scientists, and they are expecting to have the best answers that they would like to hear. But so be careful with this message. We need to take time to only take the positions that are truly validated or ongoing with the validation. I am the director of a center of research that is very important, the Cordeliers Center of Research, located in the center of Paris. We have now more than 500 people in the center. And it's a very, very difficult period, because we had to close, as in the other countries, we had to close our center. And so there is nobody currently in the lab, except in the animal facilities, or some projects that are developed on COVID field. But so it's very difficult particularly for the fellow and the students that have to stay at home, and that's very important for the prevention, for sure. And this is completely necessary for us. But in this situation, we have to facilitate also the scientific discussion and the progress of the project. And that's not easy, but we try to keep the contact, and also to organize the meeting with video conference, and to discuss science, and to continue also. There is not only the project and science on COVID, there is also other disease, and for sure liver disease are very, very important, and liver cancer and etc. And we need to work for the future and for all the patients, and to continue also our work. It's not because we are closed that our science is not necessary. For sure, our science and our work as a researcher is necessary to improve the care of the patients at the end. And we need to continue to work and to be optimistic it will be only a defined period. I hope the shorter it should be, the better it will be. But then we need to manage that at best.